everybody. Welcome back to Pelvis Party. My name is Becky Monpetit. I'm with Rochester Local. This is Britt Marschall from Olmsted Medical Center Marketing and Communications. And this is Dr. Chris Klingele, urogynecologist at Olmsted Medical Center. And today we're going to talk about something that a lot of people don't talk about. Pelvic organ prolapse. What in the actual heck is pelvic organ prolapse? Okay.
Sounds bad.
Sounds not awesome, right? Prolapse just doesn't sound like a pleasant word. But for lack of better terms, it's where stuff kind of falls out, right? How about the expert?
Great, thank you. So that's exactly it. You know, the bladder and the uterus and then the back wall of the vagina, where the rectum is right behind that, is weakened, again, like a hernia. So I kind of use the example of like a plastic pop bottle. Mm-hmm. If you squeeze the sides, there's a lot of pressure and the lid can come off.
Okay.
So think of your abdomen like that. And it's not the lid that's coming off. It's actually the vaginal organs, the bladder, the uterus, that start to come out.
Start to come out.
Pelvic organs are prolapsing out through the opening.
Okay, so this sounds very extreme, right? It sounds extreme.
Yeah. It's a hernia. So a lot of people know what hernias are.
Yeah.
Their kids are born with them, you know, the belly button, and men and women both get them. But mostly women, since the women only have pelvic organs, like a vagina and a bladder, they get, you know, pelvic organ prolapse, and men don't, obviously.
Okay, so when you're going out for coffee and hanging out with your friends, do you talk about pelvic organ prolapse?
No.
This is not something that I have heard a lot of. Urinary incontinence, sure. Peeing your pants, blah, blah, blah. Fine, whatever. But I don't feel like pelvic organ prolapse is like generally discussed when going out for coffee. But then that leads to an interesting thing, because people are like, okay, what is going on? What is happening? I feel something there. And they're doing all sorts of things, like trying to take a picture of it, trying to do a mirror, trying to whatever, to figure out what pelvic organ, what's going on there.
Exactly.
So tell us like what some of the symptoms might be of pelvic organ prolapse.
Yep. So this is not painful.
Okay.
You know, whenever a woman will come in and talk about pain, the first thing I say is, okay, tell me what pain means to you, because it's an ache, a fullness, a heaviness, feel like something's there that shouldn't be, and something, you know, gets worse as the day goes on. You know, if you're really active, you know, been out all day, you know, kids' soccer game, and then went and got the Christmas tree and loaded that up and things, all of a sudden it's like by the end of the day, it's like there's something not right
So it's
down
not
there.
like your baby's crowning. You're just...
I've never had that experience, but I've seen that a lot. And no, it's not painful like that, but it kind of feels and looks like that, and like there is something bulging out. You know, if it's your bladder, it's gonna kind of look like a baby's head crowning. If it's your uterus or cervix, which I always say it's a race to the front door, what gets there first. So your cervix, a lot of people say it looks like a donut, which I think is kind of weird, but it is. It's kind of firmer and it looks a little different. So a lot of women will see that also and kind of panic. What is this? Can I touch it? Can I push it back in?
Yeah.
You know, is it something bad? And so, and it happens gradually until it crosses a point. And then it's like there, and then of course you focus on it, so then it's always there, kind of a thing.
And you give it, sorry, Becky,
No.
you give it a number, right? Like 0, 1, 2, 3.
Yep, there's a stage, and women always ask, what stage am I? And I always say, don't worry about the stage, more focus on how it bothers you, you know, if it kind of interferes with your life. And even psychologically, I say a lot of women, it's like, it doesn't really bother me, but it bothers me mentally. Like, this isn't right, I don't like this. So we kind of use like a baby's head crowning. If it's at the opening, that you can kind of see it without doing much, that's like a 2, that's in the middle. And that's where most women will start to notice it.
Okay.
And it goes up to a 4, so you can only imagine what that means.
Yep.
So the other way I kind of describe it is, think of a sock, and the sock being turned all the way inside out, that's a 4.
Yeah.
And you know, I'd say most women are gonna mention something or be in to see me before it gets to there.
Right.
But believe it or not, There's a lot of women that are just busy
So
and just don't come in.
I've got a question. So your internal organs are supposed to be internal, right? They're supposed to be inside of you. My immediate thought when you think about prolapse is like, okay, well, something that is inside of you is now outside of you. Is there risk for damage to be done to these organs, like the bladder, like a scratch, or like that could once it? I just have a lot of questions.
No, great question,
Yeah.
and comes up, I would say right away is, I'm afraid of an infection.
Yeah.
I'm afraid I'm going to I said, well, you can push it back in. I'll cut it, or I have nails, or it's,
Yeah.
it's so, I would say 99% of the time, no.
Okay.
You're right. It's not supposed to be out. You have a lot of normal kind of glands and mucus glands that do their job.
Yeah.
When that tissue's exposed, it gets dry and irritated.
Yeah.
So yes, it can get dry where it cracks and they'll notice some spotting or rubbing more kind of irritation. So, can there be extreme things that are extremely rare? Yes. But I would say I wouldn't worry about those.
Okay.
It's more of just kind of a raw, irritating, uncomfortable feeling that something's not right type of a thing.
The visuals in my head right now are
I know. I'm just things are swirling. Lots of swirling.
You can go to Google and
Oh dear.
you see a lot of things there.
Dr. Google, and what does he have? What does
But
he have
that's
to say?
in this sense, I'd say it's and this is one of the cases where it's very helpful, because a lot of times women will come in and I always ask, did you Google it? And I'd say most of like 55 and younger, they did, and that's good because it's a place to start the conversation. They kind of see it, they've read a little bit about it, and
Sure.
so it's kind of an icebreaker. Not your typical icebreaker, but
You did mention something twice, and I want to ask. You said, did they push it back in?
yeah.
So can you? Do you recommend this? Is it normal? Like if you're at the end of the day and you're like, this is uncomfortable, my doctor's appointment is tomorrow, I just need to do something about it now.
Yeah, good question. So I would say typically, and the other question I ask is, when you go to bed, because of gravity,
Yeah.
most time it goes back up. And in the morning, women feel the best. I say, do you get up? Do you not feel it? Do you feel the best? It's easier to pee. It's easier to poop because things aren't, they're like, yeah. And I said, okay, it's probably prolapse.
Okay.
A lot of women will just figure it out and they'll lay on the floor, go in bed, put their feet up, and kind of gravity helps things go back in. It comes to a point where sometimes it gets to the point where it doesn't go back in as well.
Okay.
And yes, a lot of women will push it back in, especially to help, go to the bathroom,
Sure,
to help
sure.
pee.
Sure.
Because I say it's kind of like a garden hose when you kink a garden hose.
Oh, okay.
So
yes.
they'll learn if they kind of push things back in. And,
Okay.
so, and you're not, what I always tell women is you're not going to do something extreme enough that's going to hurt because you're going to stop. So,
sure.
A, you don't need to push that hard, but B, your body, you're not going to like push past the pain type of a thing too.
Sure.
Yeah.
Maybe that's why, so a lot of us call our monthly friend, our
Yeah,
period,
uh-huh.
Aunt Flo or whatever,
Yeah.
give it a name.
Yeah.
Like this sounds like a friend that comes to visit sometime, maybe during
Yeah.
the day, and then goes away at night.
Yeah.
That's yes, and I will say a lot of women name it, and again, they're the ones that have the fun personalities, and they'll come in and say, I got a whatcha who's it, and I'm like, tell me about whatcha who's it, and what's really fun is when the partner's there and they'll look at him and say, yeah, he's got a name for it, it's his twin Bob or something like that. And, but that's a couple that's like a couple that gets it.
Yeah,
And,
right. They're not new in their relationship.
They're not new in their relationship.
Okay, so on Pelvis Party, we talk a lot about things that happen to women, things that we've, normalized conversation about. But then we say, don't settle. We don't have to settle.
Right.
So you say, women will be like, well, it's just something that happens to me. And they lay on their back and they know that it'll go away in the morning. And then at the end, they'll just have... But they don't have to. They don't have to live like that. We don't have to settle for that. So what are some things that can be done to address pelvic organ prolapse?
Yep. So, and I would say what the first thing I always talk about when I say, tell me how it bothers you. And that can be physically, like, you know what, I'm active, it's uncomfortable, it's pressure, it rubs, it's achy. And I say, does it keep you from doing stuff? And a lot of women will say, no, I just want to know what it is and that it's okay. And that's okay too.
Yeah.
You know, might it get worse? It might. Might it have reached its max and not get any worse? It might. So, you know, I say, if, you know, you're not going to hurt yourself or really cause any damage. Those things are, you know, rare. Yes, it may be uncomfortable at times and things like that.
What about sex, though?
Yep, good question. So this may be a little inappropriate, but my comment to that is guys are just happy to be in the game.
Oh,
But will it hurt you?
No. So it can be, you know, so again, that could be another podcast later about sex and as going through the ages. You know, it can be a little dry and irritated, so, you know, use some lube and things like that. But you know, a lot of women and men will be like, well, can I pop it? And I'm like, no, it's not a balloon. You're not going to pop it. It moves, and so it'll move with sex.
Okay.
So no, you're not going to hurt it.
yeah, it was a great question.
It can, again, there's that pain with sex is common. There's, you know, I would say there's uncomfortableness, mostly kind of from lubrication issues, but actually prolapse shouldn't hurt during sex. And no, you're not going to hurt it. So yes, you can, you know, push it back in, and that may help things. Now, it's probably going to fall back out if you're up on your feet and kind of moving around and doing stuff. So back to the what can you do about it? So I always say you don't have to do anything. We can watch it. Like a month from now, a year from now, 6 years from now, you may reach a point where you're like, okay, I'm at a point where now it's like this isn't going to work anymore. Again, you know, if you've ever heard of a pessary.
We learned about pessary. Yes, we learned a little bit about pessary.
And I'd say, you know, using a diaphragm is what it's similar like, or even a tampon. So it's a device that, you know, women insert and it kind of falls in place and it just holds everything in. And again, not painful. The biggest thing I hear is it causes infection. No, it doesn't. It doesn't. I mean, yes, you have to take care of it by say, do you wear contacts? Do you know, you have to take your contacts out. So you have to take that out periodically, things like that. So those are non-surgical things that help your symptoms. And a lot of women don't have time to have surgery. I get it, you know. Either kids or life or work, or they're just like, I'm not going to take 6 weeks to recover from a surgery. And I totally get that. So you can use a pessary. They've been around a long time. They're safe. They're not bad. They don't cause infections if you take care of it. Like you don't leave your contacts in for 3 weeks like I used to do when I was in college. So, and they work great. But again, what I say is there's a group of women that like, yeah, sounds like a great idea. And then there's a group of women that I get a look from and I just know right away, okay, we're not going to go there because they just like, no, I'm not going to do that, which is okay. And then surgery is what I say is, you know, I'm a surgeon, I love to operate, but try to avoid surgery at all costs. But if you need surgery, I would say, you know, a lot of good operations. Long-term success rates can be very good. And, you know, it takes care of the problem so that your symptoms are better, and a lot of women just feel better about themselves. You know, they want to be intimate again because they're worried, like, well, I don't really feel like things are right down there, and so things like that too. So, you know, with surgery though, and we can talk about that more or less, you know, you have to plan it. Like, you got to make sure your life, you know, you are not doing all the things you want to do for 6 weeks because it's got to heal. And that's just as important as the surgery.
Sure. Well, that makes a lot of sense. So when we boil it all down, first this happens, and it's good to be aware of it, and it happens to a lot of people, and it's good to be aware of it. The second is that there are options, right? There are options to take care of this. It's nothing to be frightened about, but it is something to address. And so we want you to be empowered to address these things with your primary care physician or primary care provider. So we're really grateful that you came on the show today to talk about pelvic organ prolapse and helped educate us a little bit about what we can do. So
Yeah.
thank you to you, and we will see you next time on Pelvis Party.